Now, there are different type of sports injuries. It can vary from, say, from a small minor cut, abrasions, what we call as small wounds, and from there it can range even up to major injuries like dislocation of the joint or the fractures of the joint. The usual injuries which we come across, especially in the younger population, are the ligament injuries, and ligament injuries can lead to instability of the joint. Usually the knee and the shoulder are the most common ones which are involved, but apart from that, the ankle sprains, the recurrent ankle sprains can also happen to the younger age group. Sports injuries nowadays are on the rise. It's become quite common, and we come across a lot of patients with injuries, sports injuries nowadays. But and especially with a lot of people taking to sports, like even the amateur sportsman, the occasional sportsman, who are usually a lot of these IT professionals who go and play on the weekends without much warm up, without much training. They go and play, and suddenly they sprain their joints, and they can injure their joints. So those are the ones which affect the not the irregular sportsman, but as the level of competition is going higher and higher, as number of matches being played by sports persons are increasing, the sports injuries are also on the rise. And in fact, one of the major reasons is lack of proper physical training. I always tell, and it has to be an individualized training. It has to be an individualized training. You cannot give the same kind of physical training to a runner and same kind of physical training to a cricketer. Even in cricket also, the batsman and the bowler, they need different kind of physical training. Same comes the role of physiotherapist also, who keeps assessing these patients and players, and making sure that they are injury free. Now, apart from the apart from physical training, the most important thing is to prevent injuries. Apart from the need of preventing injuries, that can prolong the even the playing years of the sportsman. Because nowadays, if a player misses a season, he's going to lose millions of dollars, that kind of thing. So that's the amount of competition also nowadays which is there. So everybody wants to be fit, but again, it's a high demand area. Regarding diagnosis, the sports injuries are usually they come to the casualty or the hospital, and then they are first treated by the casualty medical officer, and they are seen and they are sent for x-rays. If good history and physical examination is very important while treating the sports injuries. And usually most of the injuries, if it is fractures or anything, can be diagnosed by x-rays, but the more the complicated ones, that means the ones which have ligament injuries or the injuries to the meniscus, which is the structure in the knee joint, or same way the shoulder injuries, they are usually diagnosed by either ultrasound or MRI scanning. Now, but the first person to see these injuries is the physiotherapist who is on the field. The physiotherapist should be able to assess the patient properly and make sure it's a minor injury or a major injury, and whether the patient or the player needs to be shifted to the hospital. Even shifting to the hospital is also very, very important when such an injury happens, that make sure that no further injury happens to the player. So whenever an injury happens, that area has to be protected well.
So doctor, what are the treatments for the sports injuries?
Now, the treatment depends on the type of injury. If it's a simple sprain, say grade 1 sprain or grade 2 sprain, they can be treated by rest, ice packs. The injured part should be kept elevated, and at the same time it should be, sometimes it has to be protected with a splint or a plaster. But before that, I always tell, the most important thing is on the sports field. not to aggravate the injury, not the injury should not become worse. So the most important thing is, so a lot of times we come across that the player says that, or even the students in the school, they say that I sprained my ankle and somebody tried to